Good morning, everyone. We'll give it about 3 more minutes and then we'll get started. Okay, before we get into the presentation, presenters, if we can allow everyone that's in the lobby to join, if there are any attendees waiting. And if I can get a thumbs up that everyone is in the lobby at this moment, I'll go ahead and get started. Okay, thank you, Matthew. All right, well, good morning, everyone. I want to thank you for taking the time to join us this morning. This is our final TLC regional meeting, so we're very excited about that. My name is Shelley Roselle, and I manage the TLC program. If I haven't met you yet, I look forward to meeting you maybe in the fall during our benefits administration training. Before we start the presentation, I want to first thank you for taking the time again to attend this session, and I'm hoping that you're doing well and your families are doing well. Before I go into housekeeping, I want to turn the presentation over to the Associate Director of Policy and Instruction for the Office of Health Benefits, Freddie Oliver. So Freddie, when you're ready.
Good morning, and thank you, Shelley. My name is Freddie Oliver, and I am an Associate Director here in the Department of Human Resource Management, also the Office of Health Benefits. My role is that I oversee the state health plan, the Line of Duty Act program, as well as the local choice program. And I want to echo right off the top, I want to thank you all for your attendance, because I know all of you are busy and you committed a significant amount of time to understand what we're doing and how things are changing. So thank you for that. And also, in addition, thank you for your business and sticking with us as a trusted client. Also want to take the time to thank Shelley and the TLC team, and as well as Common Health. As you all might imagine, there's a lot of work that goes on behind the scenes to make sure that we provide the level of service that you deserve. Also want to thank our vendor partners that are on the line and have also dedicated and reserved an amount of time today and over the last week or so for the last couple of presentations. Um, and thank them always for their spirit of collaboration to make this program a success. Um, you know, I wanted to speak because I wanted to make sure everybody um, understands that we understand that this year has been a bit challenging, and for some of you, that has shown up in the renewals that have been delivered to you. Um, I don't think it's a secret that across the nation, as well as even on our state health plan, we've experienced an unprecedented rise in some pharmacy claims costs. Um, and we have experienced some utilization in other areas too, but by far pharmacy remains the highest. And most of that can be attributed to GLP-1s. And some of you, I'm sure you've heard about GLP-1s. And in addition to GLP-1s, also specialty drugs. Um, and as we have approached this year and looking at utilization and different things, um, we would not be good stewards of the program, and it would be fiscally irresponsible of us if we didn't react to some of the patterns and trends that we're seeing. And I first want to touch on specialty drugs. And we've made some adjustments in the benefit designs to what we feel like can address some of that trend that we're seeing and maybe curb it. Um, and that adjustment, as we see it, and as what we've, as we did our homework and did our research, brings us into somewhat of an alignment with the marketplace. Leslie Tucker's on the line with Anthem, and she's going to talk more about that in her upcoming slides. Secondly, we talked about GLP-1s, but they're the glucagon-like peptide drugs, but they're commonly referred to as GLP-1s. And as you may know, these drugs were initially created to treat diabetes, but they have now become widely known and advertised for help with weight loss. But as we talk about GLP-1s, there's an important distinction that needs to be made. GLP-1s used to treat diabetes are still covered, and there will be no change in that coverage level. And I can't say that enough. GLP-1s used to treat diabetes are still covered, and there'll be no change in that coverage. Some examples of those are Ozempic and Mounjaro. The GLP-1s that have been removed and no longer covered under your prescription drug benefits are those specifically for weight loss. And some of the most common names you hear about that is Wegovy and Zepbound. Now, this change also brings us into into alignment with the marketplace um, after doing our research and doing our homework and doing our due diligence. Again, Anthem will have and Leslie will have some additional statistics in the coming slides that will address some of the things that I've mentioned. But I wanted to make sure that you all heard that from me as far as the direction that we're going. Um, on another note, we're also pleased to share some programs, and our vendor partners have done an excellent job pulling together some things to address the overall population for folks that may not have any specific conditions, but they're healthy and they want to stay healthy. So there are also programs along with our partner, with the vendor partners, as well as Common Health, and they'll get into that. That's something that kind of addresses the entire population, not necessarily those that are dealing with the condition. And as I wrap up, you know, um, we're conducting these meetings in a virtual space, and there's professional courtesy that we ask that because we're doing it in this particular forum. And that comes with some limitations. So as much as we would like to take some questions and do certain things, the logistics would make it, almost impossible to manage. But there is a chat feature that we'll be monitoring, and we'll try our best to get answers to you. Not necessarily, I won't call it live, but as quick as possible. But I would ask that you reserve that chat for general questions that may be something simple, maybe something that the entire population could benefit from the answer. But if you have specific questions about your renewal, about anything that I've said, about any of the changes we've made, I would ask that you would either contact your Anthem account manager or reach out to our TLC policy box, and we will answer those more on a one-on-one kind of offline basis because, again, we want to keep the meeting moving. We want it to be productive for everyone. In closing, I'll say the same thing that I opened with. Thank you for your business, and I look forward to our continued partnership. Um, Hope we have a great session, and I'll turn it back over to Shelley.
Thank you, Freddie. Okay, so everyone is muted, and that is by design. I want to be sure that everyone is benefiting from this forum, and I want to avoid background noise. So you are muted. And as Freddie mentioned, the chat, please use the chat feature for any general questions. And we will respond to you as best as we can in real time. And my plan is to provide a Q&A in the coming weeks to address all of the questions and send it out via TLC e-news. So stay tuned for that. The webinar would likely end at 1. I don't foresee us having an early ending based on our past meetings. They've been very productive, and we have some great presentations. So please plan to be here until 1 o'clock. If we end presentations early, then I'll try to address some questions in the chat. There are 2 10-minute breaks built into the forum this morning. We will have one at the end of the morning once Anthem and Delta Dental has presented. We'll take a 10-minute break, and then we'll have another one in the afternoon session. So the presentations are going to be by me as part of the TLC staff, and Anthem Blue Cross Blue Shield will follow with Delta Dental of Virginia after Anthem and Common Health. And then we'll have the afternoon session. We'll have the regional partners present. So we'll have Centera Health Plans and Kaiser Permanente. I will allow them to introduce themselves during their presentation. I won't take that thunder from them. I always like to share the history of TLC for those that are new to TLC, as well as the seasoned employer groups. So the program was created by the General Assembly in 1990, and we're very excited that we're still offering this program 36 years later. So I like to brag on that. I'm sure that senior management does as well. The Commonwealth of Virginia Health Benefits Program is governed by the Virginia Administrative Code. So you may ask, what does that mean? Well, that means that our eligibility rules, participation and contribution requirements, compliance requirements, and our policies and provisions are all regulated under the Virginia Administrative Code. The Department of Human Resource Management, that is the plan sponsor, and also the Central Human Resource Office for the Commonwealth of Virginia, and as well as the health benefits programs, but specifically the state health benefit program, of course, TLC, and also the line of duty. So the Department of Human Resource Management is the plan sponsor for all of those health benefit programs. The Office of Health Benefits is the agency that designs and manages the health programs. So all of the health programs that I just mentioned, we're all in the same office doing the work every day to be sure that we're designing and managing the program. And we're located in downtown Richmond. So the value of TLC, or I also like to refer to it as the importance of TLC. There are some things that I like to highlight about that, starting with the lower administrative costs, as well as the lower medical and pharmacy trends. We still like to acknowledge that we are still doing that. I know that the rates have increased, but we are still offering the lower administrative costs to you. We have 5 statewide offerings, which are the Key Advantage plans, and we have 2 regional offerings, which are our HMO plan offerings in Tidewater in Northern Virginia. Another one of the value is our bundle benefits. And this is important to highlight because the options allow employers to offer a different plan each year, or you may be able to offer more than one plan based on your market segment. So when we bundle the medical pharmacy, the dental, the vision, the behavioral health, also known as EAP, this allows your employee to have a very comprehensive medical plan offering. So that's one of the unique features of the local choice program. So we're proud of that. So hopefully by now, everyone on this call have received their renewal from their Anthem account manager. If you haven't received it and you don't know who your Anthem account manager is, please submit a question or let us know via chat so that we can respond to you and let you know who that person is. If you know your Anthem account manager, but you still haven't received your renewal, please reach out to that individual. You may refer to them as your Anthem rep. We use that term interchangeably. Excuse me, my tongue's a little tied this morning. But if you haven't received it, let us know because we want to make sure that we get that to you. So we're coming up on the certifying renewal data sheet season. There are deadlines to submit your renewal in Cardinal. If you're a July group, your deadline is close of business April 1st. And if you're an October group, your deadline is close of business July 1st. I do want to mention that we're not in the renewal season yet for October renewals. I want to stress that because I get that question every year where October groups are trying to certify data sheets during this time. This is only the season for groups that renew for July 1. I will send a communication out when it's time for October groups to renew. So when you're completing your data sheet, I just want to point out a couple of things that are important to know. First off, the classifications. Make sure that you're selecting the classifications that you want to provide coverage for. So for example, if you decide you want to offer coverage to retirees, you need to indicate that on the data sheet, as well as part-time employees. If you're offering for the first time for next year, plan year 26-27, you want to make sure that you're making that selection on your data sheet. You also want to be sure that you're selecting the plans that you're offering to those classifications, along with your employer-employee contributions. So when you're selecting your class, you want to be sure that you're selecting the corresponding plan that's associated with the class. So for example, if you're offering coverage to part-time employees and your plan is Key Advantage 500, you want to be sure that you're selecting that on the data sheet. So you want to make sure that you're showing the part-time employee class and the corresponding plan of Key Advantage 500. The same applies if there's a plan selection change. You want to be sure that you're selecting the appropriate class. If you choose one and you miss choosing the other corresponding option, you're going to receive an edit or an error. So we will try to alert you and remind you to go back and correct that. And my mouse is not working. Sorry, guys. Okay. All right. So the Cardinal Forum. We have a forum every year, and we're going to have it again this year. So for those of you that are new to the Local Choice Program, this is your first year, you may want to know what this is. So this is the forum that we do every year to go over the data sheet and how to complete it. We do this because we want to educate any of the HR professionals within your employer group that are overseeing health benefits on how to certify the data sheet. So please be sure that you are registering for this forum on Wednesday, March 11th. It's from 10 to 12. And again, it's very informative, and Cardinal does a fantastic job of going through the steps to certify the data sheet. The invitation was sent on February the 19th, and I also sent a TLC e-news this week as a reminder to everyone that this forum is taking place. So be sure that you're registering for it, and it's going to help you in getting your data sheet certified. I'm going to go back to this slide for a minute because I've been getting paper data sheets from some groups already, and I've been returning them back. And the reason I'm going to send them back is because we're early enough in this period that you can get access to Cardinal as a core user, and to give you the ability to access your data sheet. I only accept paper data sheets if we're at the end of the renewal period and we're getting close to the deadline and I haven't received a data sheet. I don't see that you've certified in Cardinal, but I'm not going to accept them now just because you've done it historically. I'm encouraging everyone to get your access to Cardinal. You're going to need it for various reasons, and we'll talk about that in the next slide. So this slide, I provided the website for Cardinal. And once you get to that website, the TLC Locality User Access is the tab that you want to go in to access the form. So it's called the Locality Security Access Form. That's the official form that you would need to complete to gain access as a core user in Cardinal. There's also instructions for the security access form. You will need this access for the daily business activity that you're doing for your employer group regarding health benefits. And I encourage you to complete this form. Once you are granted access, let me go back. Once you complete the form, be sure that you're returning it to tlc@dhrm.virginia.gov. Once we get that form, we'll look over it, make sure that it's completed thoroughly, and then we'll forward it to our Cardinal security officer for approval. Incomplete forms will be returned back to you. We cannot accept incomplete forms for security reasons. So if it's incompleted, we'll send it back and give you instructions on what you need to do to correct it. Once you are approved, you'll get an email notification from the Cardinal security officer with registration information. And again, I can't emphasize enough that you need this access to certify the data sheet. So this slide, I just wanted to give you a little cheat sheet per se on how to complete the roles. So when you're completing the data sheet, there is a section where you have to select the roles that you want to have access. So I gave you a little screenshot here to the right. And I recommend that you use this as a guide because I selected the boxes for you. And these are the boxes that you need to select to be sure that you're getting the proper access as a benefits administrator. This will give you the ability to certify your data sheet in addition to accessing your employee records if you wanted to check the status of a record in Cardinal. So be sure that you're using this little screenshot when you're completing your form. So we're going to pivot. We're going to talk about open enrollment. So if you're a July group, your open enrollment period will be May 1st through May 15th. This is a designated open enrollment period as we've done in the last probably 3 years now. So be sure that you are conducting open enrollment and you're receiving any election changes during this period. Your forms are due to DHRM by May 22nd, close of business. If you're an October group, your open enrollment will be August 3rd through August 17th, and your forms are due to DHRM by August 21st, close of business. This is not a complete re-enrollment. So no action is required if you're a participant or employee. We kind of use that interchangeably as well. We refer to them as participants, you call them employees. But if they're not making any changes to their membership or their plan, no action is required. I do want to let everyone know that the employee self-service portal will not be available this year for open enrollment. So the only option is to send the TLC enrollment form to our office for processing if there are any changes. I do want to emphasize that if your employee is completing a TLC enrollment form for open enrollment outside of this window of May 1 through May 15th, we consider it to be an invalid election, and we will return it back to you. The same applies for October groups. Any forms completed outside of this window will be returned as invalid. So as benefits administrators, you have responsibilities during open enrollment. So I just want to touch on your responsibilities very quickly. The first is to reconcile your open enrollment changes in Cardinal. And there's a Cardinal enrollment report that you can pull in Cardinal to do that. I provided the navigation for you. However, if you have questions, you can always reach out to our office for assistance. You should also order and distribute your open enrollment materials as needed. Leslie Tucker is going to touch on the Anthem materials ordering portal in her presentation. She'll talk about that a little bit more and your options. You should also inform your employees of any allowed changes, costs, and the timeline to make those election changes. We often get inquiries where an employee was not informed of their elections and what they were able to do, and it does cause a problem. So be sure that you are communicating this information to your employees. You should also conduct open enrollment meetings. While we have a designated open enrollment period, you should be conducting your meetings internally. I recommend leading up to May 1 that you have meetings so that everyone is on the same page. You should also obtain enrollment forms from your employees. Please be sure that they're completed thoroughly, signed and dated within the stated open enrollment period. Updating TLC contacts is very important in our office. We need to be sure that we are keeping the correct TLC contacts on file. So keep in mind that if you have someone today that's currently in one of the 4 roles, benefits administrator, benefits executive, a payroll administrator or payroll executive, and they leave your organization, we need you to update that role. There's a TLC group data change form on the website that you would complete to either put someone else in that position, or if it needs to be you in 2 positions, that's fine. But we want to be sure that we have updated TLC contacts in the system. The purpose of that is we want everyone to get the TLC communications. That's very important. But then the other important reason is to contact carriers. If you're not listed as a TLC contact, you will not be able to contact, for example, Anthem to inquire about your invoice, or if you were trying to assist one of your employees, you will not be able to contact Anthem to have that conversation, because the first thing they're going to do is check their system to ensure that you are the person listed on their file. And if your name isn't showing there, then they're going to have to refer you back to my office. So just to recap the important deadlines for the data sheet, again, if you're a July group, you need to certify by April 1st. If you're an October renewal, it would be July 1st. And again, it's not your time. I will send a communication to everyone that's renewing in October when the system is ready for you to certify. Also, I want to also mention that it appears that a couple of you are being very proactive and you're trying to certify your data sheet now, and you're not able to do so. And the reason is because it's not ready. Cardinal is still configuring the system for renewal season for TLC. So hold tight. I recommend that you attend the forum. They usually announce during the forum when the data sheet is ready for you to certify. So please make sure you're registering. So if you're trying to do it today because you're trying to be proactive, you're not going to be able to do it. If you were to go into the system and look at your data sheet today, you'll still see the current plan year. So just be patient. And like I said, in a week or so, you should be able to do it. The open enrollment, just want to remind you, May 1 through May 15th for the July renewals, August 3rd through the 17th for an October renewal. And please send those changes to us by the stated deadlines of May 22nd if you're a July group, August 21st if you're an October group. So I surveyed attendees in the first training webinar that we had on February the 26th, and I surveyed them for interest in another in-person training. We've done it now I feel like we've done it for 3 years, and I wasn't sure if we were going to do it this year, but I did get a lot of positive feedback. People want it, so I will plan to be on the road sometime in October. I'll get with the team and we'll plan another 8-hour benefits administration training. We'll travel around the state and I'll send out the communications once we get everything firmed up. I'll let you know the dates and locations. Just an important reminder here, when you're sending inquiries or any emails to TLC, please be sure that you're using the appropriate email address. So if you're sending anything that has an attachment of any kind, it doesn't necessarily have to be the TLC form, it could be any attachment. But if there is one, I need you to send that inquiry to tlc@dhrm.virginia.gov. If you just want to ask a question, and it doesn't have to be necessarily related to policy or provision of the program, but specifically that, make sure you're sending it to tlcpolicy@dhrm.virginia.gov. Any question at all should come to that address so that we can respond to you from the policy team. The local administrative manual, also known as the LAM, I wanted to include this in the presentation as a reminder that this is your resource as a benefits administrator or anyone designated in your office to oversee health benefits. This is a good resource for you to use. It's on our website. You'll see our address here. It does have the policies and provisions of the local choice program. And I kind of did a little snippet here. It's under the Group Benefits Administrator tab on our website, and you'll see where I highlighted it under resources. Please use this as your first resource. I promise you that if you go there, you will get an answer to most of your questions. I would say 99% of your questions will be in the LAM. I'm not saying that we're not available because we're always a resource for you, but you can get a quicker answer if you go to the LAM. We are a small team and we service over 400 employee groups. So we try to respond as quickly as we can, but we want you to get assistance. So try the LAM first so that you can get your answer a lot quicker. Of course, if you can't find it in the LAM, you can certainly send in a question over to the TLC policy mailbox. So that are required notices. I wanted to talk about this a little bit in the presentation as well, because currently we're providing notices in the Key Advantage member handbook, and we're also including the CHIP notice and the HIPAA privacy notice as an insert in your enrollment packet. But I'm going to make some changes to the notification process going forward. I'm working on that now, so give me a couple of weeks on that. I will send a TLC e-news out with the changes that are being made to notifying you of the notices, so stay tuned for that. If you want to get a copy of the CHIP notice or the HIPAA privacy notice right now, you can go to the TLC website. They're out there under notices. You can print a copy of either notice if you need to, so that you can distribute it to your employee. If you're ordering packets, they're going to be in your packet. Okay, so that's the end of my presentation. Please feel free to submit any questions in chat. If you have questions afterwards, you can always send that to the TLC policy at dhrm.virginia.gov. We're going to pivot because I'm going to stop sharing, and Leslie Tucker is going to bring up her presentation for the Anthem presentation.
Thank you, Shelley. Can everybody see and hear me?
Yes, ma'am.
Thank you. All right, so I am Leslie Tucker. I am the account manager for the overall TLC program, and I'm very happy that everyone was able to join today. We're going to go through the Anthem contacts for the plan, just so you have those handy for yourself. We're going to talk about the healthcare plans and the changes, and then we have some new benefits that we're rolling out. So want to go through all of those. You will get a copy of the presentation. We will send that out, as Shelley mentioned earlier, when we also respond to questions. So I just wanted to make sure everyone knew you would get a copy. So wanted to talk about your Anthem team. So we have a group of 18 different account managers that are busy getting renewals out to all of our TLC groups, helping with open enrollment meetings, anything that you're needing to assist you throughout this open enrollment season. That's what the team is there for. They can certainly, again, help answer questions about your current plans that you have in place if you want to discuss making changes. And again, open enrollment meetings, any assistance needed there, or health fairs, they're available. And then I did want to point out our customer service line. So that is available to you as a benefit administrator to ask any claims or membership questions. And as Shelley mentioned, it is very important that you keep your group contacts up to date so that we know that you are authorized to speak on behalf of your group. We have a nice mailbox that if you have questions about billing or even membership questions, you can email that box and that team will respond. They usually respond day of. They're very quick on their responses and hopefully very helpful. If you are asking for some type of a billing question that requires a little bit of research, they will keep you updated on the status of that research. But that's a nice resource. I guess I always want to remind you, TLC is actually the keeper of all the enrollment membership details, and then it comes through to Anthem. So if there's ever something that doesn't seem right or there's an error, we always need you to go back to TLC to get anything corrected. So if a name was misspelled or something like that, we would need you to go through TLC directly. But general membership questions, we can certainly help with that. Oh, sorry. And then I just wanted to point out employer access on anthem.com. I know a lot of you use this site, and it's a great resource. You can download your monthly billing statements. You can actually pay your bill online if you elect to do that. But another way that it's helpful is you can look up membership information. So if maybe you have a new hire that started and you're wanting to make sure that Anthem's received the membership in our system, you can find that there. You can verify dependent coverage, date of birth, all of that, but also order ID cards. So a really nice site. If you don't have access and need access, please just reach out to me or to your account manager that is working with you through the renewal, and we can help you and your team get access. This is just a nice listing of where you can go to get help. So again, TLC has a lot of great information on their website at thelocalchoice.virginia.gov, but Anthem also has a lot of information about our programs at Anthem for TLC. We've listed the site for the enrollment materials. This is a new website, and we'll talk a little bit later about that, but that is where you'll go to register your open enrollment materials. Then we've listed, of course, the eligibility emails for sending any changes or new enrollments, and then listed all of the phone numbers for all of the plans here. So Anthem's customer service number, as well as Kaiser and Centera, excuse me. And also if you had claims questions, you can go directly to those vendors. All right, so we're going to just talk about the health plan. So benefit changes for the upcoming year. Benefit changes go into effect on the day that you renew. So if you're a July renewal, these changes will go into effect July 1. If you're an October group, these changes won't go into effect until October 1. We are expanding the EAP coverage to all employees at your organization, regardless of if they are enrolled in TLC. Linda Pace is going to talk a little bit in greater detail in just a little bit on that, so I won't take away from her. But then as far as TLC changes on medical plans, for the high deductible health plan, there is a slight increase in the plan year deductible. This is to meet the IRS minimums. So it will increase to $3,400 for a single or $6,800 for a family. A nice benefit that's going into effect at renewal for the Live Health online visits is that on the high deductible health plan, the deductible will be waived for those services, and there is no cost share to members. So this includes coverage for Live Health online medical visits, psychology, psychiatry, and EAP visits. So that's a really nice, I think, change in that. That's first dollar coverage for them. They don't have to meet deductibles. So hopefully that will be well received. Then on the Key Advantage plans, we do have some pharmacy tier changes. So on tiers 2 and 3, we are adding a $150 deductible that needs to be met before the copays go into effect. So the maximum for a family would be two members meeting the $150 deductible, or $300 total. Tier 1 drugs are generic drugs. Deductible does not apply to them. It only applies to tiers 2 and 3, $150 deductible. Then tier 4 is, again, having a $150 deductible apply. And then after that deductible, it will be 20% coinsurance up to $200 max per script. So $150 deductible, tiers 2, 3, and 4, max of 2 family members that have to meet that $150 deductible. And then the pharmacy formulary change, again, this goes into effect at your renewal date. Weight loss medications, including the GLP-1s for weight loss, will be excluded. So again, effective on your renewal date. Impacted members will be notified approximately 60 days out before your renewal date. So Anthem will be sending an email directly to those members, notifying them of the particular script that they are taking and letting them know that that will no longer be covered. We're also going to be providing additional information to those members so that it gives them options and suggestions for how to continue taking those medications outside of the TLC plan. So there will be good information for the members on that letter. So again, that will go out approximately 60 days before a group's renewal date. And I know Freddie mentioned earlier that they had to look at things differently this year because of the large increase in prescription drugs this year. So we did want to share some information with you specifically as to why TLC is making this change. So again, weight loss drugs are no longer covered as of the renewal date, and you can see the listing of the drugs that includes. What is important to note is that coverage for type 2 diabetes will remain in effect. So these prescriptions are still available for type 2 diabetes diagnoses. It's only when the diagnosis is for weight loss. And why did we have to do this? It's because we saw a huge increase in this drug spend. And I'm talking just this one drug spend. So we've shown 3 years of history here. First year it was offered, it was 15 million. It then jumped to 39 million the next year. And this year it was over 53 million. So you can see that we just could not continue to offer that coverage and maintain rates that are feasible for our groups to be able to present to their members. By removing this coverage, this actually helped us lower renewals 6% overall, all groups. So this was something that we did not take lightly. TLC did not take lightly, but it was something that had to happen. And some other things that contributed to making this decision was this aligns with the marketplace. So TLC was very unique in that they offered this coverage. Anthem does not offer this in the commercial market for non-TLC groups. The regional carriers for the TLC plan, they do not offer GLP-1 coverage. So we were certainly an outlier there. This also helps prevent against adverse selection. So if you're a county and there's a schools nearby that's in the same program and you cover it, but they don't, you might have more people getting on your plan because they want that coverage. So it does prevent adverse selection. And there are starting to be ways for users to be able to purchase these directly. So I'm starting to see these on television commercials, but there are ways that members can go direct to consumer to purchase these medications, not using the employer-based plan. So again, the letters that we send out to those impacted members will address some of these options for them. And then just a few reminders about the plans in general. All of our plans use the preferred provider organization, the PPO network. This is a wonderful statewide network as well as across the country and even internationally. It allows members to see any doctor, go to any hospital that's participating in the PPO network. They don't have to choose a primary care physician, and there are no referrals to see specialists. It's just really important that employees and family members think about where they're going to get care and look at the network and make sure that they're going in network, because they're going to pay less out of pocket for facilities and provider charges when they're staying in network. Just a reminder about the plans that are offered through Anthem. So we have 5 plans that are offered to active and early retirees. Those are unchanged. We haven't really, it's the Key Advantage Expanded, the $250 deductible, $500 deductible, $1,000, and then the high deductible health plan. So at open enrollment, you have the option to, like Shelley mentioned, make changes if you wanted to. If you have less than 15 employees on the plan, you are limited to 1 product. If you have 15 to 99 eligible, you can offer up to 2 products. And if you're an employer group with 100 or more eligible, you can offer 2 Key Advantage plans, the high deductible plan, and or a regional plan. So depending on your group size, that's what determines how many plans you can offer. Then I've just included this chart, which gives a nice summary of the benefits, and I think is always helpful to keep handy for you as you're talking with your employees. I've outlined the changes here, the high deductible health plan and the increase in the individual deductibles to meet the IRS regulations, and then the pharmacy changes for the Key Advantage plans. So those are aware. So you're aware of those. I think it's really important when members are looking at which plan to enroll in for the upcoming year, they focus in on a few key items. One, of course, is always going to be premiums. How much is it going to cost them? I understand that. But then they also really need to make sure they're comfortable with the deductible that they're selecting for their plan. If they're going from a Key Advantage Expanded and you offer a high deductible and they say, I want to save money monthly, they need to be prepared to be able to pay that deductible amount. And the other item is the out-of-pocket limit. So an employee needs to make sure that they're comfortable. If I have family coverage, what is my maximum liability in that plan year? And this has it all out here for you, just lays it out nicely as a nice summary. Okay, so we did send out, or Shelley sent out an e-news notifying you that there was a new materials ordering site. The website is listed here. If you were an existing user on the old site, you had a link where you could log in and create a new password in the new system. If you've never used it before, it's no problem. You just can use this link, go directly to the site and register to use the system. Feedback has been positive. I think it's a much user-friendly site. That's not very good English, but it's definitely easier. I think everyone has said just to get in, find your materials, select what you're ordering, and place the order. So any issues that come up, of course, please reach out to us. We'll certainly walk through and help. And now we're going to talk a little bit about the EAP program. I'm going to turn it over to Linda Pace.
Thank you, Leslie. And Shelley, I believe you wanted to say a few words.
Yes, ma'am. Thanks, Linda. So I've been monitoring the chat, and there's two things I need to speak on. The first is I will send the presentation out in an e-news. We wanted to wait until we were done with the series of meetings because it's always evolving with new questions and comments, and we want to make sure that we are addressing everything as best as we can. So I'm going to send a presentation out once we're done. So give it a couple of weeks. Within the next 2 weeks, everyone is going to get it. That's a TLC contact. The other thing I want to speak on is I'm seeing that there are some AI assistants in the chat, and I'm going to have to ask you to turn them off. For security reasons, we cannot allow AI bots on our platform. This is a security risk for the Commonwealth of Virginia. So if you're currently using Otter.ai or any type of AI bot to assist you in note taking, again, please go ahead and turn that off. And if we don't see it taken down, we're going to have to address you in chat. So I don't want to do that. So please go ahead and discontinue use. That's it, Linda. Thank you.
All right, great. Thanks, Shelley. Okay, well, thank you so much for your time, everyone. As Leslie said, DHRM has decided to expand the EAP program to all employees of your organization, full-time, part-time, etc., even if they do not have the local choice for their health insurance. Previously, that was a requirement, so now it's available to all of your employees. In the past, some of you have opted to purchase what we call a standalone plan to cover those employees that were not covered under the local choice. That will no longer be necessary effective July or October, depending on when you renew. And I have already reached out to those groups. If you have any questions about that, or if you didn't hear from me, let me know, but I'm taking care of everything behind the scenes. You don't need to do anything on your end. And as far as communication and how those employees that do not have the health insurance will access the EAP, they will access it the same way as those employees that do have health insurance. You can call the phone number listed there below, 855-223-9277. And then they can also go to the website. Previously, they had a different login, and now they would just use anthemeap.com with the login, the local choice. Will this EAP provide supervisory referral assistance for employee issues? Yes, the answer to that is yes. I'll show you a little bit more, a little deeper dive on logging in. Just a reminder that the EAP is available 24/7. It's 4 free visits per employee per year. Per issue. So if you have an issue related to your marriage now, and then in 6 months, you get 4 visits for that. And then in 6 months, if you have an issue related to your finances, then that would be 4 separate visits. So I'll have Leslie go to the next slide. And EAP is available to those that are not eligible for health insurance. And it's available to full-time and part-time employees. It's available to everyone. Yes. So this is the landing page. I'm sorry, I'm trying to do the presentation and look at chat at the same time. So right now I'll probably just focus on the presentation. This is the landing page. So when you go to anthem.com, anthemeap.com/the local choice. This is the page that it takes you to. We've highlighted the sign in up in the upper right corner in the red circle. There is a lot of information that you can access on this website without logging in. But if you want to book an appointment directly online, then you would need to sign in up here. When you sign in, there is a question that says, indicate your health insurance, and those people that don't have Anthem insurance or the local choice would just say no insurance, and they can bypass that screen. So other than that, their experience is the same as those employees that do have the health insurance. Next slide, please. We have in-person and telehealth options. Obviously, since COVID, telehealth options have become exceedingly popular. In-person options, I'm not going to take a deep dive into that. You would search online. You would need to log in so that they could be sure that they access the correct mental health and EAP network. And then you're going to search there for a counselor just like you would for a cardiologist or a dermatologist, etc. But we're excited about our 3 telehealth options that are available to you. And I'll go right to left. I'm just talking briefly about each of these and telling you the difference between the 2. The first one being Live Health Online. So we'll go to the next slide, Leslie. So Live Health Online, a lot of you are probably familiar with that. You've probably used it for your medical benefit. The thing that you need to remember, if you are booking an EAP visit through LHO, you need to call us. You will have a live person communicating with you. They will send you an email with step-by-step instructions on how to set up your account, get logged in through Live Health Online. And then the most important thing is they will send you a coupon code that will zero out the cost of the visit. So when you're going through the checkout process, it looks as if you'll need to make a payment, but just like on Amazon or if you order anything online, when you enter that coupon code, it'll show that your owed amount is $0. So that's Live Health Online in a quick snapshot. And now we'll talk about Talkspace. Again, you can access that through the website, or you can scan this QR code right here. They will ask for your organization name, which is the local choice, and then there's step-by-step instructions there. The biggest thing to remember about Talkspace is that they will ask questions for you to provide information for the type of counselor that you wish to speak to, male, female, ethnicity, if you have any religious preferences, and then they will pair you with a provider. So Talkspace picks the provider for you. You can have a free consult just to see if you and this provider click. And if you don't, then you can ask to be reassigned. Also, when you get the assignment of the provider, that person will have typically an intro video about themselves, just telling you a little bit about them so you can kind of get a feel for things before even meeting with them. And then lastly, Headway is our newest provider. We joined with Headway back in July. We're super excited about this. We have a special contract with the state for quick appointment availability. They do have the option of in-person or virtual. They have an incredibly huge and diverse network and lots of different options here. We'll go to the next slide. A couple of things that I really like about Headway, the quick appointment availability. This is a screenshot of after you click on that link, it takes you straight to Headway. And then on the next slide, you can see the provider profile. So you can see their picture. They all have a little bit of information about themselves. You can see when their next appointment availability is. And then on the next slide, you'll see where you can actually book the appointment online on the right-hand side. I did these slides back in the summer, so that's why it says August and not March, which I can't believe we're already into March. But you can see that this person has a lot of availability. Some slides will have a camera beside it or a chair, and that means it's in person or virtual. And then lastly, I'll just kind of touch on some of the benefits that are available to you. Just a quick reminder, you're probably all familiar with the critical incident responses. These are those situations, the death of an employee, potential layoff, something that impacts a lot of people in your organization. You can call the phone number. You call one phone number for everything, 855-223-9277, highlighted in the blue bar down at the bottom. They're available 24/7. You will talk to a live person. They will ask you some questions, and then we will get the counselor either on site or virtually for you. Again, these are the situations that impact a lot of people in your organization. We have one big bank of hours for the state and for local choice. So we do have a 4-hour limit on the CIR availability, unless it's an extreme situation where you have to cover multiple shifts and huge swaths of people that are impacted. And then lastly, the trainings, a lot of you are familiar with this, a whole variety of topics. We can do these virtually or in person if you just want somebody to come out and talk to your employees about the EAP benefit and everything that's available. I'm happy to do that for you as well. Again, either virtually or in person, as schedules allow. And that's set up through the anthemeap.com local choice website. You'll go to the manager's resources, and then you'll see the training request form and also the catalog there of topics to choose from. So that's just a quick overview of the EAP. And I believe next there is there a cost for Headway? This is Headway is an EAP provider. So if you're using it through the EAP benefit, those visits are covered under EAP. And one thing I'll mention is after you exhaust your EAP benefits, your 4 visits, then if the provider is participating in the health insurance and you want to continue to see them, then it would fall under the medical benefit, and that BH copay, the behavioral health copay, would apply. And then this flyer is just the one that goes over your employee facing flyer, that's a tongue twister, that we can provide for your employees. And I believe this is always included in your enrollment kits. So thank you very much.
Thanks, Linda. All right, I wanted to talk about some new programs, wellness programs that we're rolling out. We are actually rolling these out starting April 1. So employees may start to get some materials on this, but wanted to make you aware of what they are. 4 new wellness programs that are condition specific. Catapult is an at-home biometric screening test that can be sent out to members. Hello Heart is an interesting one to help employees monitor their cardiovascular health. Verta is a digital diabetes program. This is actually going to be replacing the current LARC diabetes program that Anthem has in place. If anyone is currently enrolled with Anthem's LARC program, they will receive materials in the mail notifying them of this transition and help make sure that they register and start the program with Verta. And then lastly, it's Hinge Health. This again is a digital physical therapy program. It is replacing SWORD that is currently in use. So again, if you have members who are using the SWORD program at home, they will be notified of this change, and the Hinge Health contacts will reach out to them and help make sure that they're set up under the new program. And then just wanted to give a little bit of detail on each one. So why were we implementing this virtual checkup? We all know it's really hard for employees to get out and make sure that they're getting their annual physicals and their on-site screenings done. So I think it's a great resource for those folks who are having a hard time. That's what this program does. It reaches out to those who haven't had any screenings in the last year, make sure that they have this opportunity available to them. So they'll get a kit that is mailed to their home, and it includes all of this information, and it's shipped directly to their homes, gives them a simple blood collection device that they use, and it actually tests their blood as well as it's a blood pressure check. Then the member completes a history of screening and submits that to virtual checkup. And then those test results are then reviewed with a nurse practitioner once the results have come in. And this shows you what some of the values are that they measure through this program, talks about some of the health history that they review with members as they're helping them. And then again, there is that face-to-face engagement with a nurse practitioner once the results are in for their screenings. And that allows them to talk with that nurse practitioner, and develop an action plan. And they can certainly even share those results with the primary care physician and make any plans for future, care if needed based on those results. Hello Heart, this is another new program. This is, again, allows members to monitor their heart health at home, and definitely something interesting that we haven't ever offered before. So a member gets a blood pressure monitor that connects to the app, and it helps detect additional risks such as an irregular heartbeat, and then guides members to the appropriate level of care. And what's nice about this is the reporting that you get, it's something that you can share with your doctor to let them understand how your heart is behaving basically in between visits. Because, we all go into a doctor's office and we get a little nervous with that, what is it called, the white coat scare or whatever. So your heart may be racing when you're in a provider's office, but this, at least they can see, okay, on a regular day or over the night, how is your heart performing? So that's definitely a nice program. It's available to anyone who's 18 or older. The one caveat is they must have a smartphone in order to participate. So they've got to have that app. And then there are clinical qualifications that they have to meet. They either have to have one or more of either high blood pressure, currently taking medicine for cardiovascular disease, and or a woman 52 plus who's gone through or is going through menopause. So those are the folks who are eligible to participate in this program. Simple process to enroll. Members would simply log into the website. They can call into the web, however they're most comfortable registering. Hello Heart is then going to verify that they're eligible to participate in the program. The member's going to get a link to download the app. And once that app is downloaded, the blood pressure monitor kit and everything will be sent out to the member's home. So really nice new program. I hope it's definitely well received by the members. And I meant to mention this, if I didn't say this before I started talking about these 4 programs, there is no cost to employees to participate in any of these 4, right? It's all included as part of the health package. So I think that's also very nice. Okay, oops. VERTA, again, this is replacing the LARC diabetes program that we have in place. But we all know that 3 out of 4 U.S. adults experience metabolic health and conditions like obesity or type 2 diabetes. And this program helps by working with the member, trying to make sure that they're focusing on nutritional therapy, eating foods that normalize blood sugar, and then they use an app to monitor their biomarkers and can share this then with their telehealth team. So the team actually works directly with the member. They've got the VERTA health coach who's helping develop a plan for that member specifically. They do have providers at VERTA that then can work with the individual, and if they need prescriptions, need to talk about the clinical aspect of their condition, they can help. And then they also loop in the patient's primary care physician as well. So you really have a nice group of folks trying to help and support your employees as best they can. So I think, again, those folks who are currently in LARC will get the transition letter and let them know this is the new program starting in April, but new members can request to register for that as well. And then lastly, Hinge Health. So again, virtual physical therapy program. This is going to replace SWORD, but it gives members that ability to have physical therapy visits at home on their own time, not having to schedule an appointment, go into a physician's office. It's led by a physical therapist, developing what exercises need to be performed for their specific condition. And again, just a really simple way for folks to be able to access care on their own terms by using that virtual option. There's the website here. They can scan a QR code. We are in the midst of getting benefit summaries for all 4 of these programs, and we will be posting those so that you can share those with your employees. And if you have a health fair or something, these are definitely great programs to be able to promote at those health fairs, and then throughout the year. So if you need materials, reach out to your account manager or myself. We'll be happy to share those with you as soon as they're available. But thank you all very much for joining. I appreciate your time, and we look forward to serving your members in the upcoming year. Thanks.
Thank you very much, Leslie. We're going to keep moving. However, if you need to step away, please do so. We're going to make sure that this presentation goes out. I can't say it enough. So go ahead and stretch if you need to. So next, we're going to have a presentation from Delta Dental. So presenters, when you're ready.
Yep. Are you going to project the slides? I just see your desktop right now.
Okay, sorry about that, guys.
That's okay. That's a busy desktop.
I know, I'm a busy lady. Is it showing up yet?
No, there it is. It just needs to expand. There you go. Perfect. All right. Well, thanks everybody. My name is Ryan O'Donnell. I am the account manager for the Commonwealth and the TLC programs. Allison Clements and I work closely with the team, and we are happy to present a couple of things today. We can keep going. Yeah. All right. So there will be no benefit changes this year. And obviously your dental will continue to be administered through Delta Dental of Virginia. And you're going to have, again, the two options to choose from, the preventive and comprehensive.
I'm sorry.
That's okay.
Having technical difficulties.
There we go. Thank you. So the preventive plan has no deductible and no plan year maximum, but it only covers preventive services. So just make sure you keep that in mind if you enroll in that program. And you do have the option for a more robust plan through the comprehensive plan. You have preventive coverage at 100% and basic services like fillings covered at 80% and major services like crowns covered at 50%. Both the major and basic services are subject to a $25 deductible and have a plan year max of $1,500. And that does reset every year. So you do get that new $1,500 when the plan year starts. And then you also have orthodontic coverage at 50% up to a lifetime maximum of $1,500. And that is covered for adult and children. So as a reminder, TLC does have access to Delta Dental's 2 networks, our PPO and our Premier. Our PPO network is slightly smaller, but has the deepest discounts. And the Premier network is a larger safety net type network. And while the savings are still significant, they aren't quite as deep as that PPO network. And members can also access out-of-network providers, but you'll have the highest out-of-pocket costs because non-participating providers are not required to accept our contracted fees, and they can balance bill any difference. As a reminder, we have our Healthy Smile, Healthy You program. So members with any of these health conditions can be eligible for perhaps additional fluoride application beyond the age limit, or additional exams and cleanings and that sort of thing. Your pregnancy, diabetic, and high-risk cardiac condition members are automatically enrolled into these programs as long as they are enrolled in your medical carrier's condition care program. If you have cancer treatment under a weakened immune system or kidney failure or dialysis, you do have to complete a form to send that in. And I do want to note that we removed the physician signature requirement to help you guys get enrolled in those in that program and access to care. So just keep that in mind, and you can actually access the form directly on the member portal as well. So your prevention first is included in the dental benefits. And basically what this means is it allows the members to use the full max for your basic and major services. So any services you receive that are preventive and diagnostic do not go towards that annual max that you do have. And even if you do max out that $1,500, you are still able to access preventive and diagnostic services. So we do encourage you to go get that, at least once a year, but preferably twice a year. And then a quick kind of note to sort of explain how that works is you see that top section there, the annual max of $1,500 if you don't have prevention first. So say you went to go get your diagnostic and preventive services and we paid $190 towards those services. You would still have no out-of-pocket costs, but your annual max would reduce to $1,310. But because you guys have that prevention first benefit, we would still pay that $190 toward diagnostic and preventive services, and you would still have no out-of-pocket costs, but you would have that full $1,500 to use towards basic and major services. So one thing we like to remind members is if you're going to have more higher cost services, we usually recommend for anything over about $250 or more to request that your provider do a predetermination of benefits. It does allow you to make a more informed decision for the treatment that you're going to be receiving. It is recommended, but it's not required. And basically the process works like a normal claim. So the dentist would submit the treatment plan to Delta Dental. We'll run it through our system like we would a standard claim. And then a statement will be mailed to both you and the dentist and indicating what's covered, how it's covered, what your out-of-pocket is going to be. So as I said, it really kind of helps you make an informed decision. Just a quick reminder that you guys do have virtual visits and a hearing savings program. The virtual visit it's not going to be like you're doing your own cleaning or anything like that. It's going to be used in an acute type situation. If it's after hours or you're traveling, or perhaps you have a child who is out of state at school or something. But basically, you would get connected with a dentist. They'd be able to triage your situation and then recommend any kind of follow-up treatment. And if you don't have a dentist already that you would use typically, they can connect you to a participating provider in your area so that you can save that money as far as the discounts go. And the Ampliphone for the hearing aid is a company that we have partnered with, and you would work directly with them. And really the only thing that you have to tell them is that you are a member of Delta Dental, and you'd be able to access the discounts that they do have through that. And they're pretty significant. So we do recommend that you take a look at that if you have any kind of need for it. We do have a unique benefit page for you guys set up. It's deltadentalva.com/members/TLC. And this really houses all things Delta Dental and the benefits that are included for you guys. And you can access that benefit brochure. There's oral health resources. You can do a provider search on that landing page without logging in. And then you see up there at the top right corner, you can actually sign in to your member portal where you can look at your claims. You can live chat with a customer service rep, that sort of thing. And this just kind of gives you a highlight of what it looks like when you go into that secure page. Again, you can check your benefits and eligibility. You can enroll in that Healthy Smile, Healthy You program, check your claims, that sort of thing. And one thing we do like to note is because your member ID card is through Anthem, it does come with a prefix, a 3-letter prefix. So if you are newly registering, if you could go back one real quick. Thank you. If you're newly registering on the site, just make sure that you use the numbers and the suffix. So in that example, it's the 3456789 LC. You can use that or your social security number when registering for the site. So just make sure that you leave off that 3-letter prefix when you register. And then we do have a mobile app. It uses the same login information of your member portal. And you can, again, pretty much do the exact same things that you do on your member portal. You can search for a dentist, you can review your claims and all that sort of stuff. And for contact information, we do have a specific line set up for members, the local choice service team. It's available Monday through Thursday from 8:15 to 6 p.m. Eastern Standard Time, and then on Friday from 8:15 to 4:45 Eastern Standard. And then there is an email also that members can contact us through, and it's customerservice.helpdesk@deltadentalva.com. And then for any of the benefit administrators, Allison and I have a team email that we prefer our contacts to use, and it's the Central Account Management Team at deltadentalva.com. Feel free to reach out to us if you have general inquiries, or if you go to the TLC email that they have set up for you guys, somebody from that team will reach out to us, and we can respond to that accordingly as well. We do have our electronic eligibility department that you can contact either via phone or the email address. And then the benefit services or customer service line, same phone number and that email address as well. Apparently Delta Dental likes to have the longest email addresses in the world. So, but they are available to you all and they can also help with day-to-day inquiries. There's usually about a 1-day turnaround for them to respond. And then I think that is it for us. Thank you, everybody.
Thank you very much. Thanks,
Yeah.
Ryan.
Uh-huh.
All right, so we're at a commercial break. So everyone take a break. We're going to take 10 minutes, and then we'll come back and we'll have a presentation from Common Health, Centera, and Kaiser. We will start in 2 minutes. Okay, welcome back, everybody. Hopefully you had an opportunity to step away, take a little stretch break, or check your emails. So we're now into the second half of the webinar, and we're going to have our next presenter, Common Health Team.
All right, good morning, everyone, and I am so happy to be here. Thank you, Shelley, for having us, and thank you all for your attendance today. I am Felix with Common Health. I'm one of the program managers, and I'm going to tell you a little bit more about the program and what Virginia's Employee Wellness Program can do for you and your group. So let's start telling you about the team here. So we live where we serve. That means our team is spread out throughout the Commonwealth. And if you all are familiar with your agency coordinator or your wellness consultant, you know who your wellness coordinator is for your region, but this is kind of a breakdown of our map, and you'll see some names here that you may recognize, and then a few. But our wellness team coordinates activities and our communications regionally. We are subject matter experts with a wide range of training and advanced degrees in nursing, public health, exercise science, nutrition, business, education, and counseling. And we hold positions on advisory boards like the Foundation for Healthy Youth and Women's Health Virginia. We've cultivated relationships at each active group and tailor programs to fit the needs of that location. These relationships are built at all levels in an organization's hierarchy, including directors, managers, frontline workers, and they all serve as volunteers to promote wellness within the workplace. So here you can see our team. As I mentioned, I am in the Richmond area. I'm the supervisor of the team on the right. We've got Amy Moore on the left in Northern Virginia, and that she supervises the team on the left. If you recognize these names, that's great. That's who your wellness consultant on our team is. If you don't recognize them, I'll give you some contact information at the end of this presentation where you can reach out to us and we can help you identify who that person is, or you can go to our website and it's listed on there and you'll get to see that map breakdown as well. So our organizational structure allows the team to address local issues within the community they serve. We serve distinct geographic regions throughout the state and report to OHB. And our team is responsible for developing and delivering all Common Health content and materials to about 75 to 100 state and local agencies in each region. We travel frequently throughout our regions, trying to hit 3 to 5 events per week is our goal. So we're constantly on the road, getting a lot of windshield time, especially down in Southwest Virginia. Suzanne's got the largest geographic territory, so she travels throughout that area quite frequently for those of you in Southwest who may have seen her. We're well versed in video instruction, which allows our team to connect on an even more diverse workforce throughout this virtual and hybrid environment. So we try to be as flexible as we can, meeting the needs of your specific group, whether that be in person, online, or in a hybrid format. We can come out and do that as well if you have the technology to facilitate us doing so. As always, our presence in the field is kind of the best way to get our messaging out, because when we are in the field talking to you and your employees, we have that better connection. They feel more comfortable sometimes asking questions to us directly, and we can also provide resources right there on the spot. But we also can do exclusively web-based presentations and consultations for tools and employees that may not be able to attend those in-person presentations, or if you have kind of a split workforce and having an in-person presentation doesn't work for you all. So we've got kind of our timeline here. So we're going to take you back. This is our 40th anniversary. And for those of you who have seen us at the regional meetings in person, you know we love to get some music going. So this is where I would play Tony, Tony, Tony anniversary for all of you and get you up and doing some stretches. But we are in our 40th anniversary this year after a highly successful pilot in 1988. We went statewide with some staffing at VCU and Virginia Tech. In 1990, we created our agency coordinator training program. And for those of you who don't know what the agency coordinators are, oftentimes they are you all, they are the benefit administrators, but sometimes they are not. If you don't know who your agency coordinator is, or if you would like to become an agency coordinator, please reach out to us. You'll see that information at the end of this, excuse me, this presentation as well. We're always looking to recruit more agency coordinators, and what they do is they kind of are middle person between Common Health and the group that we're serving. It's a really easy task. We just ask that you distribute the information that we send you to your employees, and then reach out to us anytime you have an event coming up that you would like us to attend, or if you have a meeting or anything like that where we can come and do a presentation. It's a really easy lift. We try to make it as time efficient as possible for you all, so that the most of the work is on us. And then let's jump ahead to 2008. That's where Common Health moved in-house after being a contractor for the state. And then in 2016, we were in the Office of Workforce Engagement, and we did things like recognition, working with the volunteer program and the DEI program at DHRM. And our focus was more engagement oriented at that time, where wellness was our bread and butter. We did expand to do more engagement activities. And then in 2023, we joined the Office of Health Benefits, and it was kind of the best of both worlds, where we got to mesh what we do for health and wellness along with that engagement piece. So when we do come out to your agency, when we do our online presentations, we try to make them as engaging as possible to motivate your employees to get engaged and involved with their taking care of themselves and having those better health health outcomes. So who is eligible for Common Health? This is one of those areas where Common Health, we're kind of a catch-all. So while some services are for certain benefit plans and certain things that are for certain employees and they don't apply to certain types of employees, Common Health is kind of the glue that holds everything together, because we're available to all employees. We serve 500 plus COVID agencies, 450 plus local choice agencies. And we serve salaried and wage employees. And we also serve retirees and employee dependents 18 and older, although we don't get too many requests from the adult dependents. And one of the good things about our program is that we are a built-in benefit. So there's no extra cost for anything that we provide to you all. We don't charge because the value for us as an organization is so great. It's not an extra benefit. It's a way to cultivate the type of work culture that improves the organization. It's an engagement strategy and a recruitment tool, and it helps us be competitive in the labor market. And very importantly, as we're talking about these healthcare increases and the benefit plan changes, we want to point out that it's a cost container. So a standalone wellness program runs anywhere from $100 to $1,200 per employee annually. The market rate for just one single custom 45 to 60-minute wellness webinar costs between $500 to $1,000, but you don't have to pay any of that. You have a wellness program that delivers these types of programs to your group, both virtually and in person, that's already included in your benefits plan at no extra cost. So doing so supports effective disease management and effective communication within your group. And of course, it's just the right thing to do for employees by making sure that are trying to ensure that they're living their healthiest lives and provide them with the tools and education to do so. Common Health then has that ripple effect within their lives and the lives of their families to help support them in their wellness journeys. So it's really just a very valuable program that we have for your employees and your groups. Why wellness at work? So this is one of those questions that people want to know. Why is it the employer's responsibility to care about an employee's wellness? Some people will think that that's their own personal thing, but health is a state of optimal well-being, and healthy workers are present and productive. So there is a strong tie between wellness at work, productivity, and of course, that long-term performance. In 2018, Aon assessed our program, and 93% of the survey respondents agreed or strongly agreed that an employer has a responsibility to promote and support the health and well-being of its employees. So we see our role as guides to integrate prevention strategies into workplaces to create conditions to make those healthier choices easy. Our approach focuses on 4 pillars to take preventive approach to health and wellness, and those pillars are physical activity, sleep, nutrition, and stress management. 80 to 90% of employers offer some type of wellness program, and one of the primary reasons for that is that multiple studies have shown the return on investment of wellness programming. What the most recent one that I'm aware of is from Johnson & Johnson, and they found almost a $3 return on investment for every dollar spent on wellness programs, which makes sense given the cost of major health events running over $100,000. While not everyone is ready to make that change toward a healthier life, we kind of cast a big net and give our programming to all employees, and knowing that if we can just help a small fraction of the workforce get healthier and prevent a medical crisis, that saves millions and vastly improves that individual's quality of life. Also, we want to mitigate the rising healthcare costs that are being seen across the country, knowing that it's time to be more proactive in keeping employees healthy, especially with those major medical events exceeding $100,000, particularly heart attacks and strokes. And also, they're almost twice as common today as they were just 5 years ago, resulting in a national average increase in healthcare claims of over 40% since 2020. And we'll show you why on this next slide. Right, so COVID-19 presented some seemingly insurmountable health, life, and business challenges. Before the pandemic, 6 out of 10 Americans were living with a chronic condition, and 4 out of 10 with 2 or more. The world discovered these very same chronic conditions put people at extraordinary risk for complications with COVID-19. And according to the CDC, now that number is 3 in 4 Americans living with a chronic condition, and half of us have 2 or more. Another unfortunate trend we're seeing is that people are experiencing these conditions earlier, with younger people seeing conditions as early as their 20s, where they previously were seeing them around middle age. Nationwide, millennials and Gen Zers are seeing year-over-year growth in claims that are nearly double the rate of baby boomers. Research shows us that these chronic conditions are the manifestation of a short list of risk behaviors, which include poor nutrition, sedentary lifestyle, substance abuse, including tobacco and alcohol, stress, and poor sleep. Common Health addresses all of these risk behaviors directly through the 4 pillars of our program that I mentioned, which include moving more, stressing less, eating well, and sleeping better. Additionally, each of our program offerings are targeted, inclusive, and designed to meet employees where they are. This allows us to address the employee's needs in a flexible way that caters to your group's unique methods. By focusing on target areas that support prevention and effective condition management through healthy choices, Common Health is able to positively affect wellness outcomes. So what does this look like? Again, health education is kind of our bread and butter. It's what we do. Everyone on our team is a health educator. We receive ongoing training to provide a variety of different resources and materials and different areas of expertise to you all. So while each of our member of our team has a unique skill set and background, it's the 10 of us that come together and brainstorm these campaigns that we develop for you all. And we can kind of lean on each other for specific areas of wellness where one of our team members may have more of a background and expertise in that area. So a very diverse skill set there. And then we provide social and environmental supports, such as agency-specific programming, recognition programs, guidance on facilities, and policy assistance for healthier work locations. And then it's crucial that we get that leadership buy-in for successful employee wellness programs. So we work with leadership and prioritize their involvement, partnerships, and improving their employee experiences. Um, Screenings, this is kind of where we make sure that we are reminding people to get their health and wellness screenings. We send out a weekly well note, and a lot of times if it's a special month or where we know we're celebrating something coming up, we'll throw in a reminder that it's at such and such age, you should get such and such screenings. So we always make sure to promote and remind employees of those health screenings that they should be getting as they progress through life. And then finally, connection. And this is where we get that benefit of being in the Office of Health Benefits, because we can help connect employees directly with their benefits by delivering the most current messaging and showing them where to look for services. While we don't give benefit specific information, we do often get questions directly from employees, and we always point them where they can find the answers to that, whether that's you as the BA or whether it's the carrier, or if it's a more broader question that applies to someone in the Office of Health Benefits, we make those connections as well. We also have close relationships at state and local agencies that may be experiencing similar health and wellness obstacles as your group. For example, the Department of Corrections may have similar issues as a local correctional facility in trying to reach their shift workers. And that's where we can come in and use our experiences that we've had with these groups to share the best practices that we've learned over the years from our networking and mutual efforts. Here's a sampling of our campaigns, and these campaigns are designed to raise awareness and provide the tools for successful behavior change, motivate participants to take action, and support them with an environment that makes it easier to maintain healthy behaviors for life. Nutrition-oriented wellness efforts focus weight management and nutrition to prevent and manage obesity, high blood pressure, cardiovascular disease, diabetes, and other metabolic diseases and cancer risk. And as more and more research addresses the hazards of prolonged sitting, encouraging movement as a regular part of a healthy workday addresses this modern day problem and reduces cardiovascular, metabolic, and musculoskeletal conditions, as well as influencing stress management. So we design these programs all in-house. We have development teams on our team that come up and do all of the research to create these booklets, these PowerPoints that we do. So none of this information that you all receive from us is canned or created by someone else. We put a lot of time and research into the programs to make sure that we are, one, addressing all four pillars that I mentioned earlier with each program that we create, and two, that make sure that it's applicable to the workforce and the groups that we're serving. So we get to see some of the information on the back end, and as well as talking to you as the BAs of what you all need, and then we kind of target the programs that we're creating to address those needs. From an individual's perspective, this is how they see the program. So we show up at the workplace, whether that's virtually or online, and give employees information on how to best take care of themselves. We start the conversations about various health topics and use small incentives sometimes to drive attention to our messaging in certain circumstances like health fairs and other staff events. And then once that relationship has been established, we shift to a reflection on how this issue may impact the individual's health or life circumstances. Once that need for change is clear, we look to practical actions that individuals and groups can take to influence the health outcomes. This may mean connecting with provider services like EAP, starting a walking program, creating a stress relief plan. It's the how do I do this stage where we excel. A lot of people already are familiar with what needs to be done. A lot of the health and wellness information hasn't changed drastically since the information that our grandparents gave us when we were little. We all have some idea of what we should be doing, but the important piece is helping employees figure out how to do it and making those steps easier for them to implement in their lives. And that's where Common Health comes in. Here are some examples just to give you a visual representation of what it can look like for a Common Health to serve your groups. We've got a few situations here where we've done big classroom style presentations. We've got us at an employee wellness fair. And as we get into that season, please reach out to us and let us know if you have a health or wellness fair coming up. And we're happy to attend those if we're available. And then we've got the regional trainings that some of you may have seen us in for TLC, where we've been out in the field doing our presentations and our commercial breaks that we really enjoy doing for you all. So a variety of different situations where we can come out and serve you. All right. And lastly, here's what you can do to get Common Health more involved with your group. First of all, finding your agency coordinator. If you don't know who that agency coordinator is, our contact information will be on the next slide, and just shoot us an email and we can help you identify that person. Or if you want to become that agency coordinator, please let us know as well. Again, it's not much work required at all on your end, and it's very it's not time consuming at all. We do all of the heavy lifting for you. If you know who your agency coordinator are, or if you as the BA are that agency coordinator, or if you as the BA just want to reach out to us to schedule something, please do so. We're happy again to come out and serve you in any format that works best for your group. It's especially, again, as I said, as health fair season is coming up and open enrollment. We get a lot of requests for health fairs. Just know that the last week of April, first week of May, we are pretty busy those 2 weeks. But we will still try to make every effort we can to get out to your health fairs. If we can't get the wellness coordinator for your region, if they're not available on the day of your health fair, what we typically do is we reach out to the wellness coordinator and the surrounding regions to see if they're available, and if they are, we'll send them instead. So we try to adapt and meet your needs as best we can, and do everything in our and our availability to come out and serve you all, even when we do have some overlapping things going on. And then connecting with Common Health. If you are not getting the weekly wellness that I mentioned earlier, you can also reach out to us and we can get that to you. And then just reaching out to us if you have any general health or wellness questions, we're happy to help assist you with those as well. All right, and here is all of our contact information. And commonhealth.virginia.gov/TLC will take you directly to our website. And then if you don't know who your wellness consultant is on our team, this is the email address to our general mailbox. If you send us a message at this wellness@dhrm.virginia.gov, someone from our team will get back to you usually within the 24 hours to answer that question for you, or they'll direct it to the wellness consultant for your region and they'll get back to you. And then you can also search us at Common Health VA on Facebook and on YouTube. We have a social media page on Facebook, which is what we use primarily. And a lot of times we'll highlight events going on, what our team is doing, and if the agencies that we've been at are okay with us sharing some things that they're doing for health and wellness, we'll post things like that there. Recognition, all kinds of fun things that we like to post on our Common Health VA Facebook page. And then we have our YouTube channel where we have some short videos on a variety of wellness topics. We have some exercises that you can do at your desk, some stress management, meditation type videos, some general health education videos. So just quick little tidbits that you can gain knowledge on different wellness aspects out throughout the day that don't take much effort just to listen to or watch in your free time. But all right, thank you all for your time, and please reach out to us if you have any questions. We look forward to seeing you all, and hopefully in the fall, in person.
Yes, absolutely. Thank you so much, Felix. Okay, so we have wrapped up the presentation for the PPO plan and for my office. So we're going to shift gears, and we're going to now start talking about our regional carriers. We're going to have them present their benefit changes and products and services that they have available. So we're going to start with Centera Health Plans, and Michelle, let me know when you're ready.
I am ready. Good afternoon. As Shelley mentioned, my name is Michelle Trimmer. I am the dedicated senior client specialist with Centera Health Plans, and I handle all TLC groups that have selected to offer Centera Health Plans as one of their plan offerings. Today, I will just touch on the eligibility area, our Centera Health Plans network, the benefits themselves, some additional benefits and value-added services, and then we'll end with some information and resources for you. Okay? All right, so as a regional plan offering for the local choice, we are available for employers or your TLC groups that are located in the Greater Hampton Roads area and up into the Eastern Shore. So as your group reviews the renewals, if you are located in this area, you would receive a renewal for or rates for the Centera Health Plans, and you would select us as one of the plan offerings. Okay. Even though there is an eligibility area to offer these benefits, when you select to offer Centera Health Plans and your members enroll, they have access to our entire statewide network. So I do want to make sure that is clear. So the eligibility is limited to the Hampton Roads area. However, the network that is accessible is our entire statewide network. And you can see many of the major providers that are in our network. It does also trickle over into Northeastern North Carolina. Okay. All right, so the Centera Health Plans plan is an HMO, so we do require that you do seek services with providers inside of the network. There are no out of network benefits for our plan. There are no referrals to see specialists. You can actually go as long as the provider is in our network. You can self-direct to those specialists. All providers they can be found on our website by clicking into Find Doctors, Drugs, and Facilities, and then providers can be searched there. For anyone that has services that may creep up outside of the area, say someone is traveling for vacation or just to visit a child outside of the area, if an emergency occurs, any of those services would be covered at the in-network level, regardless of where those services were rendered. If there are dependents that live outside of the service area, and remember that service area is going to be the entire state of Virginia and Northeastern North Carolina, that's our network area. So dependents that may be going to, say, Clemson, they would want to enroll in the out-of-area dependent program, but differently. So some people may think that out-of-area is a child attending Virginia Tech. That's technically not out of the area. It is not in the eligibility area, but it is in our network area. So those dependents would not need to fill out an out-of-area dependent program. But when those dependents are basically out of state, and they complete the out-of-area dependent form, they would be able to tap into our national PPO network partner, which is PHCS, and they would receive in-network level coverage outside of that area using that partner network. Okay. All right. So throughout this presentation, I will share a couple of points where your employees, when they do enroll with Centera Health Plans, could save some dollars when utilizing benefits. So we do break down our provider network for TLC into two tiers. So tier 1 consists of Centera Quality Care Network providers, Riverside Health System, and Tidewater Physician Multi-Specialty Group, or TPMG. These are considered tier 1 providers, and members would pay a lower copay when seeking services at these providers. Tier 2 providers will be all other Centera Health Plan providers within the network. Okay. All right, so getting into the benefits that are available through Sentara Health Plans. There are no major changes this year to the benefits. There are a couple of positive things that did change as a result of the Virginia legislation relating to uh, mammograms. So mammograms are considered preventive, but there were some types of mammograms, say diagnostic follow-ups. So if there was perhaps something was seen in that diagnostic breast exam or that diagnostic mammogram, and the patient was called back to have, say, further test or an ultrasound or perhaps an MRI, any of those follow-up visits will now be considered preventive and paid at 100% by the plan. In addition, there is also some extended benefits for prostate screenings as well. So all services for those two preventive services will be covered at no cost to the member. So the health plan does have a $200 deductible for individual and a $400 for family. Maximum out of pocket is $2,000 for an individual and $4,000 for family. And you'll see here the breakdown between the primary care physician and specialist in Tier 1 and Tier 2 copays. So for those Tier 1 providers for primary, those members would pay $10 at a Tier 1 provider or $30 at a Tier 2 provider. And then likewise, you'll see the difference between the specialist visit with a $20 copay, Tier 1, and $50 for specialist. Virtual care visits or virtual consults through our partner MD Live. Those services are covered 100%. There's no copay for members seeking this service. This is a wonderful service for any time after hours, or even if perhaps you can't get into your provider for an acute situation. This is not going to be for any ongoing chronic medical conditions. We would definitely direct you to your primary care or specialist. But those virtual consults may take the place of an urgent care visit. And they can be done in the comfort of your own home through the mobile app or a phone number. And members would be directed to a board certified provider within the MD Live network of providers, and they're able to triage and diagnose, possibly, most often they do, and prescribe a prescription and call that in for the member. So that is automatically a tremendous savings for any type of office visit that can be done virtually. You'll see urgent care, emergency room, and outpatient surgery. Those all have predictable copays under this plan, as well as inpatient services. You'll see that outpatient diagnostic labs and procedures, it does have 20% after deductible. So this is one of the few benefits or the few line items that does apply towards the plan deductible. And for these services, the member would have to reach their individual deductible, and then they would pay a 20% cost share for the remaining balance after the deductible. Okay. All right, and our prescription drug coverage, this is, TLC does utilize the open formulary, and formulary is just a fancy word for drug list. So your group would be afforded the largest, most expansive drug list for your members. We do have it broken down into 4 different tiers, and you will see the copays listed for each one of these tiers here. These copays represent a 30-day supply at a retail pharmacy. There is a mail order capability where members could receive 90-day supply for 2 copays through the mail. I do want to take a moment. I know there was some change with Anthem's offering, and I believe that Leslie even mentioned that Sentara does not and has not covered GLP-1s for weight loss, but we absolutely do cover them for they're the counterparts that are used to treat diabetes, or in some regard, some cardiac issues. But as it relates to weight loss, that is not a benefit that Sentara Health Plans has covered in the past, nor will we cover going forward into this year. The pharmacy benefit manager is Express Scripts, so they are also the mail order. And any specialty drugs, which would all fall on Tier 4, those are dispensed by our specialty pharmacy proprium. Okay. All right, and as Shelley mentioned, the bundled benefits. So I've just gone over the medical. So this is the dental benefit included in the Sentara Health Plan's benefit. Our dental partner is Dominion National. Members will utilize their choice PPO network through Dominion National, and it is quite similar to Delta Dental's plan, a little different, but we have a $50 copay for individuals and $150 for family. There's a benefit maximum of $2,000 per member. So if there's a family of 4, each member has a $2,000 benefit maximum. Lifetime orthodontia maximum is $2,000. Preventive services are covered at 100%, and this is all for in-network services. Basic services, the plan deductible, and then the member would be responsible for 20% co-insurance, with the plan paying 80%. And major services, also the plan deductible, and that coverage is split 50-50. Orthodontia coverage for adults and children, that is covered at 50% with no deductible applying there. And I believe, as Ryan mentioned, out-of-network services for Dominion National works very similar to Delta, where members could possibly be balance billed if they seek care outside of the network. Those providers are not required to accept in-network charges as payment in full, so members could be balance billed for the dollar amounts over what Dominion has reimbursed that provider. Okay. All right, and our vision plan. This is a full service vision program. This is our vision coverage is provided by VSP. There is a $15 copay for the annual exam, and there are discounts and allowances for glasses and all of the features as it relates to lenses and so forth. There is a little bit more information on the Sentara Health Plan's COVA and TLC dedicated website. There is a brochure that lists out the specific frame allowances and discounts and the copays associated with those. Okay. And hearing aids are also covered under the health plan. Our partner is Epic Hearing Healthcare. There's coverage for adults and children. There's just some differences between the coverage for adults and children. You'll see the difference in the benefit maximum, a little higher for the children. The copays and/or coverage. So there's a copay for adult services, and children's services are covered at 100%. Replacement is covered. For adults, it's going to be every 48 months. And for children with the little tiny ears that grow a little more often than adult ears, they could be changing a little more. Those replacements are covered every 24 months. And any batteries and supplies would not be covered for adults under this plan, however, would be covered for children. Okay? All right, now let's talk about some additional benefits that are included in the health plan. There is an employee assistance program that is available to all Sentara Health Plan's enrolled members. This would be expanded to both the subscriber, the member, your employee, and any members in their household. They would be eligible or able to get up to 5, and I just saw that said 4/5. My apologies, it truly is 5. So look at the number, not the word. Sessions within the plan year. There's also coverage for bariatric surgery And just another point about the virtual consults, again, just a place for your employees or members to save a little money. And then there is chiropractic coverage, which is administered through American Specialty Health. The plan does have coverage for up to 30 chiropractic visits. All right. All right, and then some value-added services. So these are just some things that are built into the health plan that are just there, that are added services, not necessarily quote unquote benefits per se. So we do have wellness programs and coaching available. It is self-paced on our website. There are a lot of different programs that members can utilize. Partners in Pregnancy is especially for any expectant moms, whether it's their first time or third time, they would be able to have some additional support with one of our nurse case managers just to make sure that that they are doing everything they're supposed to. And if they have any specific questions as it relates to the health plan coverage for pregnancy and then going into delivery and so forth, even things like accessing breast pumps through the health plan, those nurses will be able to help those moms get everything they need and feel comfortable while they are going through a wonderful transition in their life. So emergency travel assistance, that's another value-added benefit within the health plan. If members are traveling more than 100 miles away from home and something happens, another country, something happens, we've encountered people that have been on cruises and they have broken a leg in this particular travel assistance or emergency travel assistance has been able to help those members. And then also, if they are out of the country, they can help repatriate the member back into the country and then get in connection with our case management to make sure that there's continuity of coverage from the country where the accident or issue happened back to the States and into their own providers or other providers that may be needed. We do have an after hours nurse line that is available for all members. This is free. The phone number is on the back of members' ID cards. This is always great. And so if you're not really sure what to do or you want to speak to a nurse about a situation going on, we have wonderful nurse case managers or 24-hour nurses that staff this phone that will be able to help and direct. They can give you triage information, or they have been known to also note the system and send you immediately or send the member immediately to the emergency room because that situation warranted that action. We do have discount programs for all Centera Health Plan members. Many of these, I'll say not all, but some, such as massage therapy or natural supplements, those are not covered under the health plan, but through this discount program, members could get a little bit of savings on those particular services. Okay. All right, so an additional benefit, or this is more of an incentive program for members that may have some of the chronic conditions listed. So asthma, COPD, diabetes, or hypertension. This program is a self-reported program. So if members have been diagnosed with any of these conditions, they are able to enroll. And by enrolling, that their annual deductible, so that $200 for an individual would be waived. Medications specific to treat the condition would be, those copays would be waived. They would be at no cost for tier 1 and tier 2 drugs, as well as support from one of our case management team members. When members do enroll in this, they do need to enroll annually. And the next slide, I'll go ahead and move to there we go. Thank you. Members can enroll either through our website or by reaching out to our member services team. There are certain time periods that members do need to enroll in this program. It does need to be done within the close to the time frame of open enrollment, because we do need to set everything in place prior to the health plan or the renewal starting so that systems can be programmed to waive all of the deductibles and the copays. But if members have been enrolled in this plan in past years, they do need to enroll annually through either the website or by calling member services. Okay. All right, and for our website, so there is a website dedicated to a Sentara Health Plans website dedicated to the Commonwealth of Virginia and TLC employers. That is not the landing page here, but this is for specific members. But I will say if you are interested in reviewing some of the information on the dedicated website, that has a lot of the plan documents and information there that you as a benefit administrator can review. But when members do come on board with us, we do encourage them to enroll in Sentara Health Plans members, open up a member portal, set that up, and that members can view benefit summaries, their explanation of benefits, if they want to see how far they are in their deductible or out-of-pocket maximum. This website does show that member immediately, real time, that information. We do have sorry, my brain it stopped there for a minute. We do have a companion mobile app for the Sentara Health Plans member site. So when the username and password is set up on the website, it is the same for the mobile app as well. Okay. All right, and here are some information, some details for you as benefit administrators. This dedicated website that I've mentioned a couple of times, this has a lot of the information about the health plan listed there, a lot of the plan documents and so forth. So you will be able to access this. I believe there's even a video on there. So as benefit administrators, if you aren't 100% up to speed on the Sentara Health Plan's health plan, and you begin to offer it, or you currently offer it, and you want to share with, say, a new member some information about the Sentara Health Plan's plan, you are able that there is a website there's a video on the website that really condenses all of the information that I have shared, and I've had many benefit administrators say they use that for new hires. So we also I am part of the dedicated benefit administrators team. So I'm Michelle Trimmer. Amy Burgoyne is the account executive, and Patricia or Trish Eads is our support specialist. For any benefit administrators once enrolled or once selected Sentara Health Plans, and if you have any questions about enrollment, of course, reach out to TLC, but if you do want to reach out directly to our enrollment team as well, we do have a dedicated enrollment team email address there. And we have a dedicated member services team for all TLC members, and that information is listed there. But I thank you all so very much for your attention, and if you have any questions, please reach out to me and I'll be happy to help you.
Thank you so much, Michelle.
Thank you.
Excellent job. Sorry, that was excellent job. Okay, we are toward the end of the webinar, and we're going to next have a presentation from Kaiser Permanente. Joy, let me know when you're ready.
I am ready. Thank you very much.
Uh-huh.
Good afternoon. I am Joy Ben, and I'm here to represent Kaiser Permanente. Your TLC service team includes Leonel Zay, who is the senior account manager, myself as an account manager, and I handle events, benefits, and any membership issues, as well as my colleague Brian LeClaire, who handles reporting, additional resources, and any escalated member issues. At Kaiser Permanente, there are 35 plus medical centers across the region, which also include 1,800 plus Kaiser Permanente doctors. We are the only 5-star plan in the Mid-Atlantic states. Our commercial health plan is one of only 3 plans in the nation, and we are the only plan in Maryland, Virginia, and Washington, D.C. to be rated 5 out of 5 stars by the National Committee for Quality Assurance, NCQA. In Virginia, the counties that we represent are Arlington, Caroline, Culpeper, Fairfax, Fauquier, Hanover, King George, Louisa, Loudoun, Orange, Prince William, Stafford, Spotsylvania, and Westmoreland. The cities in Virginia are Alexandria, Fairfax, Falls Church, Fredericksburg, Manassas, and Manassas Park. So if you or any of your employees are located in those areas, you are eligible to receive the benefits of Kaiser Permanente. We're known for catching potential problems early with our robust preventative screening rates. If you have a condition that needs more attention, you get excellent care from top-notch doctors across a wide range of specialties, including cardiac care. No two hearts are alike. There are many types of heart disease, and different people need different types of care, from initial diagnosis through treatment and into recovery. You and your doctor will make decisions about your care together, and will help you with the guidance and support at every step of the way. Through our evidence-based treatments and comprehensive care and support, will help many members with heart disease live longer and healthier lives. In fact, Kaiser Permanente outpaces the nation in reducing deaths from heart disease and stroke, and our approach to prevention helps others avoid heart disease altogether. We do feature our cancer care program, because hearing that you have cancer can be overwhelming, but no member or doctor will go it alone. We have a multidisciplinary team of cancer specialists that will work with you and your family to determine the best approach for your treatment. Our experienced specialists combine earlier detection, cutting-edge research, and compassionate care. And we have access to some of the most groundbreaking clinical trials and other cancer research. When you need care, you can talk to a clinician in person, by mail, over the phone, by email, over the phone, or by video. If you prefer to visit with us in person, it's easy to schedule an appointment at a location near you. With our national network of locations, doctors, and specialists, you can get timely primary care appointments and quick lab results. Sometimes you can get same day, next day, and weekend appointments are available at some locations. And because services are connected, many Kaiser Permanente facilities have pharmacies, labs, and other services all in the same building, so you can get more done in fewer stops. We have our mail order pharmacy as well, where it's easy to refill prescriptions online, on the Kaiser Permanente app, in person, over the phone, or by mail order. You can have most delivered to your home with the same day or next day delivery, or order prescriptions for same day pickup. You can get refill reminders or alerts when new prescriptions are available to order via text, mobile app, notifications, or email. You can also place some orders by responding directly to our text messages and reminders. We'll provide status updates via text or email about shipping, delivery, and pickup information. You can also receive care from Kaiser Permanente while you are traveling. You're covered for urgent and emergency care anywhere in the world. If you're planning on traveling, we'll help you get vaccinated before your trip, refill prescriptions, and stay on top of your health while you're away. If you need to refill a prescription while traveling, you can get your medication refilled at a local pharmacy. If you need emergency care, always use the emergency services where you are. And contact Kaiser Permanente when your condition is under control to make your care team aware of your condition and discuss your next steps in your treatment. For detailed information on care while traveling, you can always reach out to our Away from Home travel line, 24 hours a day, 7 days a week, by going to kp.org/travel or calling 951-268-3900. Okay. With Kaiser Permanente, your connected care and coverage, you get in-person and virtual care in one seamless care experience. You simply sign on to kp.org or use the Kaiser Permanente app to get virtual care on demand, make appointments, order prescriptions, review your records, or more. You can get personalized care advice for certain conditions online, including some prescriptions and many lab tests. You can get 24/7 care advice by phone or online without an appointment. Whether you use telehealth services or get care in person, you're connected with a healthcare professional who can see your health record and pick up where you left off. And most of our telehealth services are offered at no additional cost. Your doctor can also advise you on whether a phone or a video visit would be the option for your care. For example, a video visit may be the option for a dermatology appointment, but if you need an in-person exam, we are always here to assist. Good health goes beyond the doctor's office. With Kaiser Permanente, you get a wide range of personalized support for your mind and your body, designed to fit seamlessly into your lifestyle. For your mental and emotional health, Kaiser Permanente provides clinical and support services for a wide range of conditions, including anxiety, stress, depression, addiction, autism spectrum disorders. Our mental health team includes psychiatrists and psychologists, as well as marriage and family therapists, addiction medicine physicians, and medical social workers. You don't need a referral for mental health care within Kaiser Permanente. You can practice self-care with popular apps to reduce stress, improve sleep, and manage overall mental wellness. For your physical fitness and lifestyle, we have some of our wellness resources that will help you stay healthy once you register at kp.org. Health classes you can choose from include a variety of classes and support groups offered in person and in online. We also have our online wellness tools. You can join a program to help you lose weight, reduce stress, quit smoking, and there's so much more that are no additional cost to our members. You can also find helpful videos and articles, health calculators, podcasts, recipes, and a whole lot more. And of course, we have wellness coaching by phone. You can get one-on-one guidance and support from a dedicated wellness coach who can help you set goals, stick to them, and most importantly, see the results that you're looking for. And you can do it all from the comfort of your home. You partner with a wellness coach that'll help you to manage your weight, reduce stress, quit tobacco, eat healthier, and increase your activity. Personalized maternity care makes having your baby with us a unique and special experience for you and your growing family. Your dedicated prenatal care team will help keep you and your baby healthy and empower you to make decisions. You can add a midwife to your team as well. You can create a personalized birth plan of how you envision your day, and we'll help you have the safe, positive experience that you want, starting with your first appointment. You're cared for and you're supported every step of the way, from our virtual as well as our in-person tours of our private birthing suites to classes and online resources to help answer many questions of expecting parents. The support that you get doesn't just stop at the delivery. We offer breastfeeding consultations and other guidance to help you and your baby have a healthy start in life. With the Kaiser Permanente plan, you are also included to receive our Visions Essentials. At Visions Essentials by Kaiser Permanente, you get personalized service and attention with our optical specialists, helping you to select frames that fit your personal style. That means you don't have to waste time returning your glasses and waiting for a new pair. That's what the real convenience looks like. In addition to that, we have our partnership for the dental side, which includes our network with Liberty Dental. So when you sign up for Kaiser Permanente for the coverage, you also get Liberty Dental as your add-on for your dental coverage. Our convenient locations in the Mid-Atlantic states include, as I mentioned before, Arlington County, Fairfax County, King George County, Loudoun County, Prince William County, Spotsylvania County, Stafford County, Alexandria City, Fairfax City, Falls Church, Fredericksburg, Manassas, and Manassas Park. And portions of Caroline, Fauquier, Hanover, Louisa, Orange, and Westmoreland counties are also included. This presentation will be shared with you as benefit administrators, and you will also be able to go online and visit kpvr.org/Mid-Atlantic, where you can actually take a tour of a Kaiser Permanente Medical Center. What's the difference between after-hours care versus urgent care? After-hours care locations are designed to care for minor health concerns such as ear pain, if you have a cold, If you have sinus issues, flu-like symptoms, a rash, neck pain, minor injuries, and maybe even a urinary tract infection. Urgent care locations will care for additional health concerns like stomach pain, back pain, deep cuts, skin infections, strains and sprains, if you happen to have vomiting, diarrhea, and nausea. In your location, the Fredericksburg for After Hours Care, as of June 17, 2024, has expanded its hours to provide after hours care on evenings and the weekends. After hours care is provided by appointment only Monday through Friday from 3 p.m. to 11 p.m. and Saturdays and Sundays from 9 a.m. to 5 p.m. After hours care is closed on all holidays. In Virginia, we feature one of our largest centers, which is relatively new. It is the Caton Hill Medical Center, which is 245,000 square feet of comprehensive care facility. It's located off of routes 450 and 50 in Woodbridge, Virginia. And it features 24/7 advanced urgent care, adult and family medicine, allergy, alternative medicine, ambulatory surgical center, behavioral health, cardiology, dermatology, endocrinology, gastroenterology, infectious disease, nephrology, neurology, OBGYN services, oncology and infusion, ophthalmology, optometry, orthopedics, pathology, pediatrics, pharmacy, labs, and radiology, podiatry, pulmonology, rheumatology, sleep medicine, urology, and vision essentials. Another close center located in Virginia is our Springfield Medical Center. It is 99,000 square feet facility, which is located off Route 95 in Springfield, Virginia. In that center, they offer adult and family medicine, lab, radiology, and pharmacy, OBGYN services, optometry, ophthalmology, and vision essentials by Kaiser Permanente, orthopedics, pediatrics, and physical therapy. At Kaiser Permanente, you can subscribe to and get additional information on various different coaching and classes that are offered. You can visit kp.org/healthy living, where you can get wellness information, health calculators, videos, podcasts, and recipes. You can visit kp.org/healthy lifestyles. This is an online program which helps you to lose weight, quit smoking, reduce stress, and more at no cost to our members. You can also go to kp.org/classes, where you can get insight on health classes and support groups at many of our locations. And you can go to kp.org/wellness coach, where you can participate and have one-on-one personal wellness coach by phone at no cost to you as a member. And that's it for Kaiser Permanente. Thank you for your time.
Thank you so much, Joy. Well, we're done. And I really want to take a moment and echo with my Associate Director, Freddie Oliver, stated in the beginning of the presentation. We are very appreciative of your business. We know that you have choices. You can take your business elsewhere to other carriers, or you have options. But thank you for choosing the local choice. And I appreciate it. I love talking to you guys. I know I'm only one person, but I try to call you back. I try to talk to you and reach out to you. And I really miss seeing you in person, because we usually joke around a little bit. But we will be back on the road in October. Prayerfully, we will be back on the road around the state doing the 8-hour BA training. But please reach out to our TLC policy email address if you have questions. Maybe you think about it after we end, and feel free to email to us. And stay tuned for the TLC e-news, which will have likely this presentation. I selected this one out of the series, so stay tuned for the presentation along with a Q&A. We're going to all work together, the team and I, we're going to work together to make sure that we address all of your questions, because some of them are the same that we've gotten in other meetings. So we want to make sure that we are addressing everyone. And that's all. So thank you for your continued partnership. Take care, and I will see you later in the year.